morning, this is Shirley from Alaska on herbs. Wild yam has been used for centuries and centuries and centuries. It has been used in Mexico since the time of the Aztecs for rheumatoid problems and pain reliever. In Central America, wild yam has been used to alleviate labor and menstruation pain, as well as arthritis, digestion problems, and muscle cramps. American herbalist uses the best for colic and indigestion. Wild yam was regularly used for reducing pain and colic caused by gallstones and for easing discomfort and passing small stones. The diogen in wild yam, approximately 40% of it, mimics. It's not progesterone, it mimics progesterone effect upon the body and becomes popular in treating PMS. Progesterone buffers the negative effect of estrogen levels, because estrogen levels when you're young can get out of whack. During a woman's cycle, progesterone levels drop drastic during the estrogen level to rise unchecked levels when they can lead to PMS, low blood sugar, salt and water retention, increases body fat, and reduces oxygen levels in the cells. Wild yam has been shown to dilate blood vessels and stimulates the flow of bile. Wild yam also possesses antispasmodic, anti-inflammation, anti-rheumatoid properties, and acts as a diuretic to relieve water retention. Wild yam has, among people of the globe, good for colic, rheumatoid, in North America, arthritis, asthma, bronchitis, Crohn's, colic, colitis, cramps, gallbladder inflammation, gastritis, especially in alcoholics, IBS, labor pain, miscarriage prevention, morning sickness, muscle tension, rheumatoid, stiff muscles, and whooping cough. And believe me, I know about whooping cough because I had it when I was a kid. I had it for 6 weeks. So I wish we knew about this. Wild yam also being used for its therapeutic action or general liver health, and has been shown to help reduce blood cholesterol levels and blood pressure, and direct benefit by the liver by increasing the efficiency and reducing stress of the liver. Wild yam contains plant estrogen, which does produce estrogenic, which has been shown to be valuable to relieve female problems. Women can now have the benefits of hormone replacement therapy without the risk of the negative side effects of estrogen. Estrogen is slow loss. Progesterone rebuilds lost bones. Density is generally related to age and depends on the gonads hormones. The reduction in this hormone with menopause is associated with sharp decrease in bone loss. There is a great decline in progesterone, then in estrogen, and progesterone begins to decline in the early ages. While estrogen slows bone loss somewhat, progesterone can actually rebuild bone loss. Dr. Lee, MD, reported that 10% increase in bone density in the first 6 to 12 months, followed by annual increase, and it keeps going to 3 to 5%, which stabilize at the level as we get older. Dr. Lee is really famous for progesterone. He uses a lot of it because he found out that it helps so fast. Dr. Lee's office-based study reviewed 6 years' experience, 100 post-menopausal women using the cream contained natural progesterone from the Mexican wild yam, conjunction with the tradition therapy. Progesterone relieved the post complaints, and the natural progesterone applied to the skin decreased hot flashes, depression, mood swings associated with menopause. Dr. Lee experienced, he found that the natural progesterone can protect facial hair and male pattern baldness. And I noticed that when women move over, you can see the baldness in the top of their head. It's getting there to be an empty space there, and it's lack of progesterone. And you get hairs. One woman, see, I wear glasses, so I can take my glasses off and see close. And I can see if I get one hair or something like that. But some people, they can only see, they can see far away, but they can't see close. And when they can't see close, they let all these hairs grow out. And it's lack of progesterone in their body. Some have it after menopause. As a side effect, the woman felt better and had more energy when they used the cream. PMS appears to be progesterone deficiency. And I have used that cream. There was one woman, she came in, and she's a pastor's wife, and she already had 5 kids. But she was trying for one more kid, and she had 4 miscarriages. So she heard about me, so here she came walking in. And I got her off her coffee, I got her off her sugar, and she was holding her weight really good, and she was exercising. But sugar and coffee was a no-no, and I got her on the cream. And she wasn't taking no vitamins, so I got her on vitamins. That's the only thing I got her on. She got pregnant, had a baby boy, carried it all the way through. So I know it can happen, but what you have to do is get away from your junk and get on something. And that progesterone, I had another girl, I think she's got 6 or 7 kids, but it holds on to the baby, that progesterone. Like if you keep losing a baby, most time it's lack of progesterone, and when you take it, it will hold on to that baby. And I just think that's so neat to find. I found that out about 20 years ago, and I just tell them, get on it and don't get off of it. And I was listening, and one other way you can use it, I have classes in my shop, and from different, this lady has a degree for skin care, and she said when you get past 35, I got organic progesterone cream here, and she said put it on your face, just a couple of drops. She said it will keep your youth beautiful, and she's right. I mean, I'm getting ready to turn 78, and honestly, my face looks, my mom's face was so wrinkled because that's why I quit wearing makeup when I was in my 20s. Because my mom, she used to wear makeup all the time, and not a lot. She just wore a little bit. I mean, it was never, most time you never even knew she wore makeup. I mean, but it bleaches your lipstick, and makeup bleaches your skin out. And so what I did was just kept it, just, normal. And then there's a cream I use. I use Pure Gardens cream, and then I use the progesterone cream. Any of the creams that gets out of date in my shop, I use it, and it has really worked. I mean, I was amazed how it worked. So anyway, you can try it, but I can remember in the class I was taking, she said that they came in and she charged them $35 or $45 just by putting that cream on once a month for them. And I do it once a week, day. That's how I used it. Because I just use a little dab. A little dab will do it. Progesterone helps to restore balance and relieve PMS. This Dr. Dalton, he was successful in using progesterone therapy for over 30 years in England. He reported complete relief of symptoms of his patients. Dr. Lee also found that patients who was hyperthyroid no longer needed the thyroid supplement because the progesterone can increase the activity of the thyroid hormone in the cells. Now, estrogen, on the other hand, interfered with the action. Thyroid replacement in excess may also aggravate bone loss. And this is the list of the, if you think, you said, well, I don't know if I'm missing progesterone or not, here's the list that the doctors came up with. You have headaches, migraine headaches, you don't have enough progesterone. Depression, mood swings, if you have self-medication, like you have to have alcohol or extra food all the time or something like that. Fibroids, water retention, bruise easily, dark circles on the eyes, inflammation, disease, bloating and gas, constipation. Now, if you just have one or two of these, I would start taking progesterone. Gallbladder problems, dry skin, digestive problems, stiffness, hypoglycemic, loss of hair, greasy hair, blurred vision, increased respiratory problems, sinus problems, puffy eyes, boils, spontaneous abortion, exhaustion, frequent urination, hot flashes, swollen joints, problem with concentration, painful muscles, and PMS. And I see all these young girls, the bottle will last them, they only take a little bit of it, but it lasts us for so long, and it helps to put that hormone. And what helps to make the hormone is your adrenal glands. And see, when you drink coffee or eat chocolate, you destroy your adrenal glands. So that's why that a lot of times people's having PMS, and it's the chocolate. They say, well, I crave chocolate. Well, it's the magnesium in the chocolate, but the caffeine does something bad for your body. So it does good, but it also does bad. And that's why I say take the magnesium and get rid of the chocolate. Since progesterone promotes balance in treating a number of females' disorders, Dr. Lee found in treating urinary fibroids, urinary tract infection, cysts, and endometriosis. The natural progesterone used by Dr. Lee is found in 5,000 plants. I mean, it's just not in one plant. It's found in 5,000 plants, but abundant in the Mexican wild yam. The national progesterone is identified to the same as in the human body. It is not the same as a synthetic progesterone. The alter of the progesterone can account for side effects including breast cancer. The chemical one that you take can cause breast cancer, facial hair growth, depression, heart disease, and liver disorders. The most common prescribed form of estrogen is derived from the urine of the mares. Estrogen from a plant is much more like the human estrogen than the estrogen from the horses. Plant-based estrogen, estrol, appears to have no cancer risk. Herbal products like Dong Quai, licorice, alfalfa all contain non-toxic estrogenic factors. Supplements with the evening primrose flaxseed oil can help the adrenal glands produce more estrogen. By using the progesterone cream, the natural progesterone is allowed to flow through the skin, go directly into the bloodstream, completely bypassing the digestive system. The cream is applied in the large areas of the skin, such as the inside of your wrist, your arm, your legs, your face, your neck, the upper chest. A 2-ounce jar should last you for at least a month. You should be done with it in a month. And it's just a little jar like that, and you put it on every day. Now that's if you're menopausal, but if you're postmenopausal, cream, you only use it for 2 to 3 weeks out of the month, and discontinue until the next of the month, because menopause, postmenopause, is only used from 12 to 26 days of the menstruation cycle. It should always be discontinued for at least 5 to 7 days. I hope that you've learned something from Wild Yam Cream. The capsule's good, and we even found out, I have another one, it's called Wild Yam Chase Tree, and that even works faster than Wild Yam. But enjoy.